So we are going to continue with etiquette in healthcare. So the first thing that we want to understand is, what does it mean? Etiquette, what's the definition? So etiquette is simply the process of how the health professional interacts with patients. So it's an interaction. Remember, this is etiquette in health care. Okay. So this interaction is between two people, and that is between the health professional and also the patient. So that is it. That is what we call as etiquette. Now, it is not just between the health professional and the patient. It can be the health professional and the patient's family, and also fellow health professionals, okay, or their colleagues. So fellow health professionals and just other healthcare givers. So that is what we call as the etiquette in healthcare provision. And so etiquette refers to the various manners and behaviors prescribed and observed in social life. What are the manners? What are the things that you do as you get to associate with people? That is in social life. So manners and behaviors that are shown in social life. So this is basically the main words. Just the manners and the behaviors that are shown in social life, the way you get to interact with people. That is what we call etiquette, the interactions with people. That is what is basically known as etiquette. So now let's look at some etiquette guidelines. Now before we even get to look at the guidelines, we need to know that how we get to interact with patients, the patient's family, and just other health professionals is part of what gives us success, and it gives an impression of who we are, our profession, and also our facility. Imagine you are ever mistreating people. So if you are ever mistreating people, just the behavior. So your interaction is going to give a description of who you are. Your interaction is going to give a description of your work, and where you work. And your interaction with people is a very big contributor to your success in the future. That is why we need to make sure and be mindful of how we get to interact with different people. So that is it we need to get to know. Now, some guidelines, some things that we need to do as health practitioners. Those are the etiquettes or the expected behaviors of us. One thing is always getting to introduce yourself. Very, very important. Introducing yourself. Okay, let me just get to write this in capitals. So introducing yourself is very, very important as a health practitioner. So when you are interacting with patients for the first time, or when you are getting, this is when you've just arrived at this workplace. So make sure that you get to introduce yourself so that people are going to know you. It is very important for you to introduce yourself in that. What if it's someone just who has come to attack? So that is why you need to introduce yourself. That is why you need to introduce yourself. So in the introduction, you need to give your name and also your job title. So this is one important thing that we need to make sure that we get to do. That is one etiquette that we should be able to have. Apart from that, we need also to be able to explain the mission. So explaining the mission, you are simply talking about your profession. What is your profession? What have you come to do? Are you a nurse, a doctor, a pharmacist? What are you? So you need to explain your mission. In explaining your mission, you need to provide information about what you will be doing, apart from what you'll be doing, and how long. Maybe you are going to be there just for a day and then another person is going to come. So you need to make sure that you get to provide that information. But make sure that as you get to explain your mission, don't use technical languages. Because you are a doctor or a nurse, you get to use the language that you can use with fellow doctors. Don't do that because you're introducing yourself to a patient. Make sure that you use a language that a patient is able to understand without any difficulty. So apart from that, it is very, very much important to ask questions. So that is one etiquette that a health professional should be able to have. Ask questions. If there's any need for a clarification, ask for a clarification. Ask for where they get to put things to use. When before you get to conduct a procedure, make sure you ask questions. There are some things that you are going to do that might result in the death of someone. Remember, you are dealing with humans here. So make sure that you get to ask questions for clarity and just to make sure that you are fully aware of everything. So ask questions where supplies are kept and how to do some things, procedures and such. Imagine you want to perform a heart transplant on a person. You don't that is your first time. You just don't do it direct. You might kill someone. So that's why you need to ask questions. So apart from that, you also need to make sure that your focus is on the patient. So that is focus on patient. Well, asking questions doesn't mean you are really blank about something. This is just professional inquiry. It is very much important as a professional to inquire. So that is professional inquiry. Now, on focusing on the patient, when you are talking to a patient and you are doing something, put away all that you are doing and make sure that you concentrate on the patient. Listen to them actively. An active listener gets to listen and also gets to answer. So get to listen to patient actively. Where there is need, get to ask. Where there is need, get to say something. But don't interrupt as you get to talk with patients. If you want to ask something or to comment on something, wait they first finish talking. So take the time to pause whatsoever that you are doing just to make sure that you get to talk to your patients. So apart from that, also the body language, very, very important. So on the body language, we need to make sure that we've got a positive attitude. Because mostly the way people take us from by what we do to them and not basically what we get to say. A lot of people are going to say a lot of good things about us, but how are you showing? So the body language, be aware of your body language. Keep your head up and maintain normal eye contact. This should be normal. It shouldn't be intimate eye contact. It should be normal eye contact. And we need to make sure that we maintain our head up, not your head is down as if you are tired or something like that. And use a sincere smile in the body language. Have a sincere smile, not a smile that you are just getting to dress on for pretense. It should be a sincere smile. So that is why it is very important to develop that heart of warmth and friendliness. And in that, it takes us to another etiquette guideline, which is common courtesy. So in common courtesy, we need to always remember to say please and thank you. Always be polite. So in being having a courtesy, you need to make sure that you are polite. The fact that you are talking to someone who has got a lower position than you or your patient doesn't mean that you are over all. So you need to make sure that you are polite in the interaction with others and make sure that you are courteous. Just that person who is welcoming, that good, so that even patients are going to have peace of mind just getting to be near you. And you are not just doing this to patients. Be polite also to your fellow workmates, your colleagues, and just everyone else that you get to find on the workplace. That is very, very important. So apart from a common courtesy, also avoid nicknames. So as you get to interact with people, nicknames are not names of people. That is informal. So we need to make sure that we are that formal as we get to interact with patients. So in being formal, we need to make sure that we address patients by their names when they talk to us and avoid using nicknames. So address them by their actual names, not Uncle Q, Uncle what, all those nicknames that we know. We need to make sure that we address people by their names, and best to address people by their surnames, and if possible, Mr., Mr., or Miss, if we know them. So that is very, very important. That's why we even get to introduce ourselves. As we introduce ourselves, we not just introduce ourselves, even them, they are going to tell us a bit about themselves. So apart from that, always remember the privacy. So be sensitive to privacy. So when a patient gets to tell you more about themselves, don't get to spill the beans and tell everyone who is close to you about them. I didn't know that that patient has got HIV. I didn't know that she's one person who used to do this and this. No, that shouldn't be good. That is why we need to be sensitive to privacy. If someone is that open to tell us about their things that they've hidden, we need also to be that sensitive so that we will be able to keep things that they've told us. So we need to make sure that we keep their business privately so that other people or other visitors won't overhear. That is very important. So another etiquette guideline that we need to have is always ensure all is well before you leave. That is a clean environment. All should be well before you leave. And before you get to ask you if there's something or anything that the patient wants. Get to ask them. So before you leave the patient's room, ask if there's anything else they would need. Make sure you leave the surrounding safe and clean. Think of this. You leave all the utensils that we are using, laser brace down and just scissors is down. What are you doing? That might kill someone. So, and some of those things are very much dangerous. So make sure that as you get to leave, everything is clean, the room is tight, and the room is safe. So make sure that you ensure that all is well. And then the other thing that you need to make sure is the dressing. Very, very important. So the dressing and also the grooming. We need to make sure that we are putting on professional dressing. Imagine as a nurse or a doctor. I'll repeat this. You put on a slitty that is that big. That is very bad. It shows a bad impression of yourself and also just about your work. So we need to make sure that the dressing is just that respectful. So people's first impression will be based on how you look. So take pride in how you look. Keep also in dressing, your ID should be clearly visible so that people will be able to see. Okay. And make sure that you don't dress to be able to bring someone down. That is for the good of your work. So the dressing and the grooming should be paid attention to very much. And even lastly on here, make sure that you keep the conversations on track. As a medical professional, your aim is to make sure that you get to listen to the patient. Don't now start crying so that the patient can now start to look on you. No, sorry for that which happened, and you overload all your problems on the patient. The problem is for the patient to offload on you, not you on the patient. So keep all the conversations on track. Don't slip out of the way. That is going to be very, very important. So, and don't say what is outside what is supposed to discuss. At times, the patients might not be comfortable with saying some things. Well, make sure that you keep everything on track. Don't bring topics that are outside the point of discussion. There are some things that are not necessary. So make sure that everything that you get to discuss with them is going to be all their interest and for the good of their health. Well, thank you so much for having been present in this tutorial. Hope that was helpful. Please, if it was, be sure to be able to subscribe and also press on the notification button so that whenever a new video is going to be posted, you're going to be notified, and be able to share the video. Thank you so much and enjoy your day.